wanted to do a quick video because I have finished my second round of clinicals. Yay! And I passed my clinical for Med-surg on a cardiac unit. So everything we were doing were pretty much cardiac and respiratory. My experience was really good. I really enjoyed it. I liked the hospital. We were at one of the top hospitals in my area, and it was like high tech. We got to go down to the OR, to the cath lab. Got to experience a lot of different things and observe a lot of different things. I learned a lot. I'm just gonna give you guys a couple of tips that will help you out when you get in clinical. Study more. Like if you have ATI or if you have Mosby, YouTube, whatever. Look over your videos and all of your skills because you're gonna need them for sure. We did all the skills in the lab, but once we got on the floor, it was different. I'm glad I really looked at my videos so that when I got on the floor, my clinical instructor expected me to be able to get the IV and everything that I needed for my IV and be able to hang that IV and know each step and do it correctly. So I wouldn't have been able to do that. I probably would have forgotten had I not looked it over. Although I know the basics, I don't know everything. It's definitely important for you to look over your videos. You're gonna need those skills. It's gonna help you a ton if you know those skills step by step, because your instructor, well, at least our clinical instructors expect us to know what we've learned already. They expect us to be able to do it. The opportunity arises. I got to draw blood. I started an IV. I gave meds and I learned the system. The hospital that we were at uses an electronic health record, so we learned how to work the system and all that. And it was so much fun. I really, really enjoyed it. Clinical before was a lot of washing and doing ADLs with patients and things like that. And this clinical, I really felt like a nurse. Like we had to do a care plan, we had an assessment, we wrote our nursing note, and we also had to write down their levels for their platelet count or their troponin or CKMB, all the different types of things, magnesium, calcium. We had to write those down, and then if they were high or low, which a lot of times they had a lot of crazy numbers. And so we would have to write why those numbers were out of whack and form a care plan for those patients. So I really learned a lot about prioritizing. I'm probably saying that word wrong, y'all. But basically I learned to put what's important first. What are we treating first? I started to think like a nurse in this clinical. And like we did vitals, of course, and we gave meds, and we had a patient and things like that. This clinical was far from Med-surg 1. It's just a pass or fail class. Another tip I will give you, when you get on the floor, align yourself with a nurse. Like find a really good nurse and try to stick with her if you can. If you can get to pick who your nurse is, or if you get to pick your patient and you know that nurse has that patient, I wind up finding a really good nurse because there's only one instructor and there was 8 of us. So each day or each time we have a clinical, she'd have to pick who she was going to have do meds. So if you weren't doing meds that day, you were kind of more so doing patient care in your care plan. And you could follow the nurse, but I found that on the unit, some nurses just don't want that. They don't want the student nurses following them for whatever reason. Apparently, they forgot they were a student nurse at one point. This lighting is probably crazy. I'm sorry, y'all. Long story short, y'all, find a good nurse because that's going to help you. And my instructor had to be up with us when we gave meds. But once I got checked off on it, I was able to get with the nurse, and she had 5 patients, and I was able to go with her with every single patient. And instead of having one patient where I learned, you know, one thing about that patient, I had 5 that she could really explain to me and I could see how the day really went. It was almost like you were doing a preceptorship. So find a really good nurse and try to stick with her. That's tip number 2, right? So tip number 1 is look at your ATI videos. Tip number 2, get yourself with a good nurse because that matters. Tip number 3, make sure your instructor sees you on the floor. We had a tendency where we were there from 7 a.m. to 7 p.m. That is a long time. You have down times in between that. You don't want to get caught just chilling. You don't want to get caught like in the room or doing things that are not productive. So try to make sure that your instructor sees you doing a good job. Make sure that she sees that you want on the floor, you're helpful. You know, you can even go to the care partners, like at our hospital, there's care partners and they draw the blood and they get orders too, and they get to do a little bit more invasive things. So we go with them like, hey, you need to do your sugars, you need to draw blood, you go with them, and that way make yourself available. In other words, don't just sit and if it's nothing going on, you're just kind of hanging out. No, get up, make yourself available. That way your instructor sees you're trying and she sees your improvement and that may potentially be a job offer right there. So what else can I say? Pay attention in your med-surg. That's another tip. Pay attention in med-surg, because the things you learn in med-surg will be in your clinical. That's the whole point. So pay attention. Make sure you know what you're learning in lectures, so that when you get in clinical, you can be like, oh yeah, that's decreased tissue perfusion, or that's decreased cardiac tissue perfusion, or decreased renal tissue perfusion. Is make sure you know it, so that way you're not confused. Make sure you know your level, so that you can diagnose your patient without asking your instructor, well, what do you think would be a good idea? You're going to probably do that in the beginning. I know I did. And once I got further along, I was able to start thinking like a nurse and figuring it out myself. I feel like I'm talking so fast and going. But I was really excited. I'm so excited to be out of clinical. My next clinical is OB. I have Med-surg 3 and OB. Med-surg 2 and OB. And I am super excited. I cannot wait. I am so excited about OB. We are going to be at a hospital that is different from the hospital. It's actually a completely different company than that hospital. And they do water births. They have a midwifery center. So I'm really excited about getting, I think we get to go to the NICU, we go to labor and delivery, and then we also go to mother and baby, I think. Not sure, but I'm really excited to go and learn more. And I do have an update video for those of you that are watching. Know that I'm TTC. I am still trying to conceive. I'm still on my journey, still waiting for things. So I haven't updated you guys yet, but I will update you. My camera's currently dying, so I have to go. But thank you guys so much for tuning in. Thank you for watching this video. I hope that if you're in clinical, you're enjoying it and you're loving it. And stay tuned for those of you watching for my TTC update, because I will be back with that update and you do not want to miss it. All right, guys, thanks for watching. Don't forget to like, comment, and subscribe. Bye.